Autism is a terrible condition. That paper that you're mentioning has been totally discredited. It was found to be fraudulent and is not the case. There have been dozens of studies of vaccines and the question of autism. Vaccines don't cause autism. They are highly effective and safe and are a good way to protect your children from vaccine-preventable diseases.
You have just heard from Director of the National Center for Immunization and Respiratory Diseases at the Center for Disease Control and Prevention. And that is how she responded when Senator Lamar Alexander asked her what her answer would be to a parent who heard childhood vaccinations can lead to autism. Despite a mountain of evidence to bolster that finding, there remain those who stay the fight and believe, in essence, the government is lying to parents. Our guest is a longtime environmental activist and attorney for the Natural Resources Defense Council, and he brings an important name in American politics to the debate. Welcome Robert F. Kennedy, Jr. to MidPoint. Robert, thank you so much for joining us.
Thanks for having me, Ed.
Robert, let's get to the issue itself. When did this become something, this autism and vaccination issue, that you knew you had to follow and you had to just hone in on all the time?
Well, let me say this. I'm pro-vaccine. I had all 6 of my kids vaccinated. I think vaccines do save lives. I think that we need a vaccine program where the vaccines are safe, and that we have a regulatory agency that has integrity and public credibility, and we don't have either of those things right now. I got dragged into this issue kicking and screaming. I was going around the country. I was suing a lot of coal-burning power plants, and one of the big issues with coal-burning power plants is mercury emissions. The mercury gets into the fish, and people eat the fish, and we have government advisories that tell people not to eat fish, or that they're consumption advisories for fish. And I was having women come up to me, mainly women, at many of the speeches that I was giving around the country saying, you need to look at the mercury exposures coming from vaccines, from the pediatric vaccines, because that is by far the largest vector for mercury getting into our children. And when I started looking at it, I'm not scared to read science. I read science for a living. I've had hundreds of cases that I've litigated, almost all of them involve scientific controversies. So I actually started reading the science, and the science did not say what the CDC claims the science says. And you just heard the head of the CDC saying that there is no connection between thimerosal and autism. I will challenge her to show me a single study that actually says that. In fact, I've put out a challenge that I will give any journalist who can show me a single study that shows that thimerosal is safe, $10,000.
Well, let me go ahead and see, because I don't think I'm going to take...
And there are literally hundreds and hundreds of studies in the peer-reviewed publication, including CDC studies, that show that there's 39 studies that show thimerosal does cause autism, and there are hundreds of other studies that link it to the epidemic of pediatric neurological disorders.
But there are hundreds of studies, if I might interrupt here, just because I do want to point out that I don't want to take your money at this point, but here I have in my hand from the CDC, from a number of researchers. In July 1999, back then, the Public Health Service agencies, the American Academy of Pediatrics, vaccine manufacturers all agreed you're talking about thimerosal. They said there is absolutely no evidence that low doses are even in vaccines. They said it's only minor reactions like redness, swelling at the injection site if there's anything. And there is a ton of evidence here, Robert, which I have to tell you says that there is no link between vaccines and autism, yet you continue to say that there is. So how do we then fight what we're being told by medical researchers?
Right. What I'm asking you, Ed, is if there's a difference between established science and the scientific establishment. The public health regulators are not telling the truth about this. And, you know, I am not the only one to say that CDC.
Why would they not do that?
Well, see,
why would they
Bernadette
lie?
Healy, who was the head of Bernadette Healy, who was the head of FDA, said that the reason they're lying is because they're scared of finding results. For 2 reasons. One is because they required people to take these vaccines back in 1989. That's when the vaccine schedule changed, and all of these huge loads of thimerosal were put into the vaccines, and that's when all of these neurological illnesses began in 1989. EPA says that was the gateway year. So they're vested in that schedule. And number two, and this is what Bernadette Healy says, they're reluctant to study something, a hypothesis that they believe will frighten people away from taking vaccines. So, and there's, I guess, an argument for saying, let's not look at something that might be unpleasant. But I think there's a much stronger argument in a democracy for saying, with science, we need to look at the hypotheses, even if they're unpleasant.
Well, certainly,
and we need to tell the truth.
I will agree with you. Look at hypotheses
let me just say this, Ed.
Very quickly, please.
4 federal studies.
Okay.
Now,
what you're saying, though, basically is that...
No, there are 4 federal studies that have looked at CDC and said that the vaccine program at CDC is a cesspool of corruption. What you just quoted me were statements from CDC. You did not quote me a study. Quote me a scientific study. I can quote you many, hundreds of them right now that say that thimerosal is causing brain injury to our children. You can't tell me one study that shows that it's safe.
There is not one
CDC
study that shows that there is the connection, though. You would agree with that? I mean, there are a number of studies showing there's no connection between autism and thimerosal.
There are many studies that show a connection. I'll give you an example. The Gronberg study in 2003, or 2013, which was published, which was a CDC study published in JAMA Pediatrics, shows that when thimerosal was removed from vaccines in 1993 in Denmark, that the rate of autism dropped by 33%. That's just one study. There's many other studies that show a direct connection that thimerosal causes autism-like symptoms in monkeys and rats and guinea pigs and hamsters, and that children who get autism are children who do not produce glutathione, which is the enzyme that excretes mercury from the body.
But can we not always say, I understand
studies.
all this, but is it not fair to say that thimerosal was removed, I think, from U.S. childhood vaccines 15 years ago? So then why are we still talking about this? Because there are those people who say that it is completely safe now without thimerosal, even if there is a connection.
Well, that's one of the, right, and that's one of the industry talking points that is, again, another canard. It was taken mostly out of the pediatric vaccines, although not altogether, in 2003. But it was added at the same time to the flu vaccine, and the flu vaccine was then added to the pediatric schedule. So not only are we giving these kids massive doses continually of thimerosal, but we're giving it to pregnant women at the most vulnerable point of a child's neurodevelopmental age.
Now, you realize, of course, though, I got about a minute left. We'll take a break, come back into more, that every doctor that we've spoken to, just doctors who aren't even involved in the CDC, they also disagree with you. They say there's absolutely no evidence whatsoever, and we have to vaccinate our children. And they even go back and they point to what happened at Disneyland with the measles, that we have to vaccinate.
Well, I'm for vaccination, but I think, I think we should have vaccines without mercury in them. The same as, just because I don't want mercury in my fish does not mean I'm anti-fish. I'm pro-vaccine, I'm just against mercury. And the doctors are reading what CDC tells them to read. They're not going back, and they're not toxicologists, they're not pharmacologists. They're not reading the original data, they're not reading the science. What they're reading, and I've talked to hundreds of doctors who said the same thing.
Okay, well, if you would do this, because...
Tell me a study.
We have to take a break, and I tell you what, we're talking about having a medical doctor here, and we're going to do just that. We'll have somebody from medicine here to discuss this, because still, there are doctors who claim that there simply is no evidence of this whatsoever, and you've stated your case very cleanly. I want to make sure that we get the other side of it as well. Robert F. Kennedy Jr., if you would, please stand by just a couple of moments. When we come back, we'll look at the other side of this and those who say that the CDC is telling the truth when MidPoint continues.
There are 4 federal studies that have looked at CDC and said that the vaccine program at CDC is a cesspool of corruption. What you just quoted me were statements from CDC. You did not quote me a study. Quote me a scientific study.
the issue of childhood vaccinations and the reality of medical evidence versus parental caution. Let's once again welcome longtime environmental activist and attorney for the Natural Resources Defense Council, Robert F. Kennedy, Jr. And to get a medical opinion on the debate, welcome board-certified physician Dr. Sanjay Jain. Dr. Jain, thanks for joining us. Robert Kennedy, thanks for joining us once again.
Here. Thank you.
Dr. Jain, you just heard the statement from Dr. Kennedy, and you also, from Robert Kennedy earlier on. Don't want to say doctor yet, don't want to get there just yet, but you heard his statement. Then what's your response?
Well, one thing I've heard a lot of is the word studies. You know, one thing I've actually been a researcher.
I can't hear him.
And I've actually researched quite a lot of things. Now, here's the thing I want to really understand. A lot of these studies are public domain, meaning that they're in PubMed. Every organization has access to these studies. So if the studies that Mr. Kennedy is quoting and name dropping, why doesn't the Institute of Medicine, CDC, American Academy of Pediatrics look at the same studies that Mr. Kennedy is quoting? These are all shared information. And if there truly is studies out there that Mr. Kennedy is saying is legitimate, why isn't the CDC looking at that study? It's all out there. It's public domain. I don't see any reason or intent for them to take those studies out and ignore them. And I wanted clarification, but it doesn't make sense to me.
All right, then, Robert, if you would clarify, please, to his point.
Well, I didn't hear anything he said.
Okay, I guess what Dr. Jain is doing, and again, I apologize for the audio issues here. Dr. Jain, and I believe, correct me if I'm wrong, is asking the CDC and their studies, but what about other studies? Dr. Jain, please repeat it again. What studies are you looking for?
Yeah, so what I'm saying is all these studies that are out there, it's public domain. These are all shared information. And
but which studies are you talking about? No. Well, what study are you talking about?
I'm talking about the studies that you're mentioning.
CDC lists,
I'll
tell you what.
The CDC is...
No, CDC lists 6 studies on their website, and all of those studies are epidemiological studies. They're population studies that were created by CDC and the vaccine industry. They're either overtly fraudulent or they have been disavowed by their own authors, and yet they're still on those websites. The studies I'm talking about are not on the website.
You're saying they're ignoring them?
So I think what we're getting to is, let me get to this, Dr. Jain. I think what Robert is saying is that the CDC is putting out fraudulent information.
Right, and here, if you look, this is a book that I wrote, where we spent 3 years with a dozen of the best scientific researchers in the country, and we went through PubMed, we went through the entire public medical literature, we found every study ever done about thimerosal, and we put it in here.
Okay, then let me let him answer then. Robert, if you would please, let me let the doctor answer, please, because I want to make sure he gets the time in here. So, doctor, we're talking about the CDC basically handing out fraudulent information, and Mr. Kennedy's own book, which he is promoting, which then points to exactly what he believes the studies are that says the CDC is lying.
So I'd like to ask one question. Are you saying that the CDC is intentionally ignoring the studies that you've researched?
Now,
yes,
Robert, did you hear
I'm saying that I'm saying the CDC is intentionally ignoring those studies, and I'm not the only one saying this. The chief scientist of CDC, Dr. William Thompson, who is still at CDC and who is the primary author of 2 of the 3 American epidemiological studies cited by CDC to exculpate thimerosal, Dr. William Thompson, in August, invoked federal whistleblower status and turned thousands of pages of documents over to Congressman Richard Posey and has asked to be subpoenaed before Congress because he believes that he and his division are at least partially responsible for the autism epidemic in this country.
Okay, let's stop there, if you will, because I'm short on time, Robert. I have to make sure that I get the doctor's answers in here. So, doctor, from the medical standpoint,
he has been ordered to lie.
Do you, as a medical doctor, then believe that you're being lied to by the CDC and that there is still a danger and a connection between thimerosal/vaccinations and autism?
As a doctor, I don't feel being lied to by the CDC or any of the organizations. And so I really want to say that as a physician, we put a lot of faith in these organizations to do the research and not to ignore anything out there. So if there's a legitimate research study out there that's proving what Mr. Kennedy is actually saying, it's their responsibility to look at that. And I find it very unusual. It doesn't make sense for any organization that's in the interest of public health would intentionally ignore something like that. That's where I'm having a problem with that.
So what would you then consider, doctor, to be a legitimate source of information that you rely on in this case?
So, there's a lot of information, there's a lot of studies out there, a lot of the information out there is legitimate and illegitimate. Multi-center, double-blind, these evidence-based medicine is the biggest way to, in terms of legitimate data. So the studies that are being mentioned, I don't have a clue in terms of who these institutions are. Is it Mass General? I mean, who are these institutions that are doing these studies?
All right, let me do this.
I want to know the legitimacy behind it.
Okay, I got about 30 seconds
I'm happy
left.
to answer those questions.
Robert, I got 30 seconds left. What about the legitimacy of these studies?
There are literally hundreds of studies by independent scientists and by CDC, FDA, and the big universities and medical institutions in this country that show that thimerosal, which is a potent neurotoxin, 50 times more neurotoxic than the methylmercury in fish. Why would we inject that into a child?
But it hasn't been injected into anybody in 15 years.
No, I just explained to you, it's still being injected to people every day in the flu vaccines in this country.
Okay.
Into children in every year until they're sick, every year of their lives from 6 months on, and to pregnant women.
We need to follow up more on this.
Why would you inject a neurotoxin into a pregnant woman?
We need to follow up more on this. We're unfortunately all out of time. Robert Kennedy Jr. and Dr. Sanjay Jain, and an emotional issue as well. We are going to follow up on this because everybody has a say in this. Stay tuned. MidPoint continues.